One of the things that you're going to have to contend with following radiation and chemotherapy is the fact that there may be some damage now or cumulatively to your heart and lungs. So you must do cardiovascular exercise. Some of you may have peripheral neuropathy in your feet, and therefore high impact activities are not only painful, but they're not recommended. A recumbent bike is great because you can have back support, and it is also going to enable you to work at a lower intensity without putting any weight onto your feet. And even in an upright bike with the venous blood flow return, it's more taxing on your heart than a recumbent bike. This is a little bit easier. So the first thing to understand is how to set up your feet, where your legs should be placed. This is a little bit too far out for me right now. Notice how my leg is locked out. I shouldn't be able to do that. So I'm going to bring my seat forward so that when my leg is going around, now I'm a little bit too close. It should never be less than 90 degrees. So that's a good place for me. I've got this 90-degree angle in my knee. And then I can sit back nice and tall. You have a couple of things that you can do to increase or decrease the intensity. First off, I can add more tension. So I can put a couple more numbers on there. So right now I'm at level 4. Now I can even work on my posture while I'm sitting here and bring my shoulders back and down, belly button drawn in, or even with my arms here, pushing back, keeping my head into alignment. When you begin doing your cardiovascular exercise, especially if you're deconditioned, this is going to be very challenging to you. You may have a hard time just doing 1 minute. So progress slowly. Allow yourself to adapt to the movement, to adapt to the time and the intensity. So if you're on level 4, you're starting to get out of breath, that means you no longer are using oxygen as fuel, you're becoming anaerobic. We don't want that. So we're going to lower the intensity so that you can carry on a conversation the entire time you're doing your cardiovascular exercise, so you remain in an aerobic state. Look at your legs. Make sure your thighs remain parallel, that they're not knocking in, nor are they bowing out. If this is causing you pain in your hip flexors, then this may not be a great exercise for you. You might try something like swimming, something that is going to take all of the pressure off of your body. But remember that with swimming, if your immune system is compromised, or you have any burns or irritations from radiation, that swimming is contraindicated during those times, or if you have an open port. Notice even I'm a little bit out of breath because I'm trying to talk while I'm performing this exercise. So do the talk test, make sure you can carry on a conversation, and think of the scale of perceived exertion. On a scale of 1 to 10, 1 would be you're comfortably asleep in a hammock with a nice breeze blowing. 10 would be, let's say, climbing a very steep mountain with a 50-pound backpack. You should be working at the lower end, maybe a 3 or 4 when you're beginning. And if you're in treatment, it may only be a 2 or 3. Then when you finish treatment, you can go up a little bit more. And when you're completely done with treatment and you're feeling better, your energy's up, then maybe you're working out at a 6 or 7. But you have to pay attention to your body. Different medications can affect your heart rate. And that's why using the maximum heart rate formula doesn't work very well. So I like to use the Borg Perceived Exertion Scale, or the Carvonen method of determining your maximum heart rate. But like everything else, start and progress slowly. Listen to your body and do what you can on any given day. Anything you do is going to be an improvement. And you can do 2 minutes 5 times a day. That's great. You build up. And then you do 5 minutes a couple times a day. And eventually you're working towards that 75 minutes of high intensity exercise, or 150 minutes of moderate intensity exercise for a week. But you have to get there. So take your time, give yourself a pat on the back for even beginning this process, and keep up the good work.